Welcome back to another episode of Relationships Uncomplicated podcast, episode 78. I'm your host, Dee Charoni, and today I talk about whether conventional couples therapy can help you heal from infidelity. Now, I'm excited to discuss this because there really isn't much information out there to truly educate couples about their options as far as help in the aftermath of infidelity. Although it seems like conventional or traditional couples therapy is the only way to go, there are more options out there to explore. So what I'll do is discuss conventional couples therapy and answer questions like, is it effective in the aftermath of infidelity and does it harm to try? And then I'm going to explore more highly effective options that you have if you've been through infidelity and you chose to stay together and heal. I'll discuss all of this in depth and, as always, provide some actionable tips for you right after this sponsorship message. This episode is sponsored by my Infidelity Recovery and Healing program, It's Okay to Stay. If you're struggling in the aftermath of infidelity but want to stay together, you can rebuild trust and heal through genuine expert help from me and my team personally. I started It's Okay to Stay after seeing couples therapy and self-help options often lacked essential components to help couples save their relationship after infidelity. It's Okay to Stay is a complete 8-week coaching program that involves an online roadmap course and one-on-one work with an affair recovery specialist. So if you have faith in your relationship and you want to stay together and heal, let's talk. I'm offering a 45-minute free consultation for couples who want to save their relationship and need expert help. If that's you, just go online to edicharoni.com/45 and pick a time for a video call that both you and your partner can commit to. I'll hop on. We're first going to start with understanding your struggle, and then we're going to walk through It's Okay to Stay to see if the program is right for you. Look, so many couples try therapy and self-help methods only to be put at odds with each other. But that doesn't have to be you. With expert help, It's Okay to Stay will give you the clarity that you need to understand each other, to heal, and to find a path forward past infidelity. So again, all you have to do to book your free consultation is to go to edicharoni.com/45. That's IDITSHARONI.com/45. I'll be honored to stand alongside with you on this journey. I have to say, it's not easy for me to discuss this because I realize that in some way I could be throwing stones at what I was trained to do as a licensed marriage and family therapist. But my intention here is not to throw couples therapy under the bus at all, but to hopefully open your eyes to what can help you and what isn't likely going to do that, all while leaving the decision in your well-informed hands. This means that after listening to this, you'll just have more information about different things that can help. There's never one option. And so as long as you know of a few options and not only one go-to option that works for everybody, then I did my job for today. Okay, 2 disclaimers. When I say conventional couples therapy, I refer to the week-to-week ongoing sessions with no predetermined timeline, no specific roadmap, simply venting and discussing the couple's issues. So this is usually when we talk about couples therapy or marriage counseling, we usually think about weekly sessions. The therapist is usually going to tell you that it's really hard to know how long it's going to take. Some even will say it will take months and months, sometimes years, and so on and so forth. And you basically put yourself into this weekly meeting that consists of mostly a place for you to talk about what bothers you in the relationship. And so I call those venting sessions, where basically one, complains about the other, or brings up complaints, or opens up an emotional wound, and it's being discussed. So I guess in a safe place. Sometimes it's safe, sometimes it's really not so safe. But that's basically all what you do. And so many times you're going to find yourself going in circles. But I will talk more about it later on. So I just wanted you to know what I mean when I say conventional couples therapy. And then the other disclaimer is, I wanted to stress that what I'm about to say here is true for couples in the aftermath of infidelity, but may not apply to all couples in the aftermath of infidelity. Which means that in some situations, I do believe that couples therapy done right, stress on done right, can actually be helpful as part of the treatment. And I'll discuss it as well. So just so you know, sometimes I do think that as part of the treatment, you cannot only have one go-to. And sometimes in certain situations, we have to combine different things in order for everything to work. Like I said, I'll discuss it later in this episode. Okay, now let's get into our topic for the day. And I'll start with the first question. Is conventional couples therapy effective for couples who want to heal from infidelity? I sadly say that I do not believe so, and that's due to everything that I saw and heard from couples I've worked with in the past decade. Now, here's how I got to thinking conventional couples therapy isn't likely going to help you heal from infidelity. I'd say that 1 of every 2 couples that consult with me have been through unsuccessful couples therapy. What I've learned from these couples about their failed process has to do with at least one of the following. Either it's lack of structure, lack of expertise, and bias. And sometimes bias combined with the therapist's discomfort around the area of infidelity. So let me explain. When it comes to lack of structure, couples therapy or couples will say things like, we keep having the same conversation. I complain about him, he complains about me, and the therapist is sitting there. They're trying to be a referee, but we're not really getting anywhere. We've been doing this for months, and it still feels like we're in the same place, like we're going in cycle. I call those venting sessions. And if you've heard one of my episodes before, you know what I'm talking about. And maybe you know what I'm talking about because you've been through that. Now, sure, it's good to vent, and you need to vent, right? You need the therapist or whoever is sitting there in front of you to understand what you're going through, your pain, and so on and so forth. But it cannot be the only thing you do. And unfortunately, what happens in those situations is that the venting is the only thing you do. Those therapists will open a safe place for you to open up and talk about it, which you will do. However, you don't get what you actually need, and you only talk and open emotional wounds, not necessarily knowing how to close them, and sometimes bleeding all the way home from therapy, trying to mend this emotional wound, during the week after. Another thing that I hear from couples who go through the traditional couples therapy where there's no structure is something like, our therapist doesn't seem to follow anything. Every session can start and end wherever, whatever we want to deal with in that day. Those sessions usually will start with, how was your week? And that's what we talk about. So there isn't really a structure. We're not moving in any specific direction, and we're not learning independently or to independently deal with the issues outside of therapy. And what happens is that therapy models are usually not designed as roadmaps. And they're not designed as roadmaps for a reason, because therapy is all about really opening that safe place for people to talk about what they want to talk about in that moment, which is great if you're in individual therapy. I don't think it's great when you're in couples therapy, because couples, especially couples in the aftermath of infidelity, need some kind of a pathway, a structure, in understanding that if they go on that path and they will do those things, they will change and their relationship will improve. And not only that, so it's a roadmap, but what's in that roadmap? Like, is it only talking? Is it only talk therapy? Let's just talk about it. Or is it filled with tools that the couple can practice with a therapist, but also practice after the sessions and after or in between? And on top of that, are these tools that are research-based or just something that the therapist thought of that might work? And on top of all of that, are these tools something that the couple can take with them for the rest of their lives? Can they apply these tools later on when you're not there to talk to them? Or are they bind to couples therapy for the rest of their relationship because they always have to come back in order to have a conversation about something? So this is about, when couples tell me that there isn't a lot of structure in the couples therapy. Now let's talk about the other main reason that I think, or that at least what I hear from couples, one of the reasons that they feel it hasn't been successful. And the second reason is lack of expertise. And this is what I hear from couples who come back feeling like they haven't really worked with an expert. They'll say things like, our therapist doesn't specialize in couples therapy specifically. So it's more like individual therapy with two people in the room. I've heard that so many times. It feels like the relationship is not addressed, but only our individual issues. This is something that sometimes boil my blood, because, if a couple chooses to go to couples therapy, they want the relationship to be addressed. They want the relationship to be the client, the center, and not the individual issues that each one of them has. Although these can be relevant, but they cannot be the only thing the therapist will address. And that happens so much. And even in that situation, sometimes couples therapists are not going to be expert in couples therapy. Many therapists offer couples therapy, but do not even specialize in relationships or even in infidelity recovery. But they still offer these services because they can, right? Just like as I am trained in couples therapy as a licensed marriage and family therapist and many other post-grad trainings that I've done, but I could still see individuals. I could still see people with anxiety and say that I can help them. I could still see people with clinical depression and help them. But I don't do that. I don't do that because I want to make sure that if I see someone, that is my specialty. I'm an expert on that. But unfortunately, not everyone does that. Now, a therapist who isn't really an expert on infidelity recovery is going to sometimes take you as a couple, and you're going to feel that. You're going to feel that really quickly. You're going to feel that you're not getting anywhere in the healing. That's the first thing that should tell you this person doesn't necessarily know what to do with couples in crisis like that. And what you're going to also feel that there's just more and more talk and spinning in circles. And so this is the second complaint that I hear from couples. And then the last one is all about the therapist's bias and discomfort around the topic of infidelity. And when that happens, people immediately feel that. And this is what they usually will tell me. They're going to say something like, the therapist took my wife's side and both made me feel horrible and unfit because I committed the infidelity. Or they're going to say something like, the therapist told me I brought this upon myself. Yes, I've heard that. And not once and not twice. I've heard that many times. Therapists blame their clients or one of their clients in the couple for bringing the infidelity upon themselves. Now, I don't think most therapists do that, but plenty do. And I think that most therapists, like all people, are biased. And, we all have our opinions about things. It's just human nature. But what we're not supposed to do is to let our bias lead our sessions. And so sometimes therapists totally forget what they're there for, and they let their bias lead them. And if that happens, they should be able to say, I'm not fit for that because I am so biased in that specific topic. And unfortunately, many don't do that. So you can end up in an office of a therapist who really thinks that infidelity is X, Y, or Z, and they're going to lead the session from that place. And you're going to find yourself, or your partner is going to find him or herself in a very difficult situation that sometimes can harm and literally do damage to the relationship and personal damage. And again, I am not just saying this, I've seen it, and I've seen it much more than once or twice. Now, when it comes to the clinician's discomfort, couples will say things like, our therapist spent 1 or 2 sessions discussing the infidelity and then moved on to working on our marriage, suggesting we should have date nights and scheduled sex. Now, I am not kidding. This is something that I hear every day. So multiple times a day, every day. Anytime I consult with a couple that has done couples therapy and I ask, how was it? Usually I'm going to hear it was not successful because of that very reason, because the infidelity was so uncomfortable for that therapist that they agreed to talk about it for maybe 1 session, maybe 2. Then they pushed it aside really quickly and offered, let's work on improving your marriage. And then as they do that, and I believe it's just impossible, you really cannot work on the marriage before you heal from the infidelity. It's like the elephant in the room. We cannot push it to the side and hope, it's going to disappear. But then on top of that, they also start suggesting all kinds of simplistic ideas like, oh, have more date nights, as if date night is going to save this relationship or make any change. And sometimes they're going to even suggest, wow, you didn't have sex. Why don't you try to have scheduled sex? I mean, wow, these are simplistic pieces of advice that really do not help couples in the aftermath of infidelity. They could be sometimes, not always, sometimes good pieces of advice, but really not at the beginning of the process, and sometimes not even in the middle of the process. So most therapists are highly uncomfortable with infidelity, let alone talking about it. Just like with sex issues, by the way, a lot of therapists are highly uncomfortable with talking about sex. And so they're going to, if you bring it and you say, oh, we're having an intimacy issue, they're going to send you to somebody else, or they're going to say, well, let's talk about it, or let's not talk about it, or they're going to be it's going to be really difficult to handle this. And so what happens is these therapists are going to push you towards working on the relationship before any real healing from the infidelity is done. Now, another one I hear often is our therapist said that he or she has no idea if we'll be able to survive this, and that we should be patient because it could take months or even years in therapy. Now, just as I mentioned before about therapy models being open-ended and less structured, this opens the opportunity for many therapists to not commit to an outcome. And it's actually in the therapist code of ethics, right? In our code of ethics, we cannot promise any result. We cannot even promise a timeline, right? So as ethical as it may be, it also exposes you as a couple to treatment that has no guarantee, no time limit, and no specific outcome. Now, in conventional couples therapy, whether you stay together or end up divorced, by the way, can still be considered quality treatment. So the outcome of the relationship will not determine whether the treatment succeeded or not. Now, it reminds me of the old saying, operation was successful, but the patient died. That is many times the case when no specific outcome is considered success. I mean, it can be just your therapist being honest with you. I'm not saying that it's done out of dishonesty, and really therapists usually will work within their boundaries and within their codes of ethics. So it can be that your therapist is just really being honest with you. But as a therapist, I like to take more responsibility and give more specific estimates based on my experience with similar cases and my expertise. I just think it's fair, to get that from a professional. Some kind of an idea of, what the outcome looks like, how to get there, how long it's going to take you. And then once you get there, what do you do? I believe you need to know those things. Now let's talk about a loaded question. Can conventional couples therapy do more harm than good? I believe that in some cases, unfortunately, it can. Those couples that I speak to on a daily basis for years now reveal that they felt discouraged, lost hope for their relationship, experienced lower self-esteem, and so on and so forth. To me, this is damage. Now, those who even after that chose to stay together, regardless, felt sentenced to a marital jail where unhealthy patterns of resentment and conflict avoidance are their share for staying in their relationship after infidelity. To me, this is not just individual damage, this is relational damage. So, if this is something you experienced or are experiencing as part of your healing journey, or if you want to avoid it altogether, let's see what other than conventional methods exist out there for you to consider. This episode is sponsored by my Infidelity Recovery and Healing Program, It's Okay to Stay. If you're struggling in the aftermath of infidelity but want to stay together, you can rebuild trust and heal through genuine expert help from me and my team personally. I started It's Okay to Stay after seeing couples therapy and self-help options often lacked essential components to help couples save their relationship after infidelity. It's Okay to Stay is a complete 8-week coaching program that involves an online roadmap course and one-on-one work with an affair recovery specialist. So if you have faith in your relationship and you want to stay together and heal, let's talk. I'm offering a 45-minute free consultation for couples who want to save their relationship and need expert help. If that's you, just go online to edithcheroni.com/45 and pick a time for a video call that both you and your partner can commit to. I'll hop on. We're first going to start with understanding your struggle, and then we're going to walk through It's Okay to Stay to see if the program is right for you. Look, so many couples try therapy and self-help methods only to be put at odds with each other. But that doesn't have to be you. With expert help, It's Okay to Stay will give you the clarity that you need to understand each other, to heal, and to find a path forward past infidelity. So again, all you have to do to book your free consultation is to go to edithcheroni.com/45. That's edithcheroni.com/45. I'll be honored to stand alongside with you on this journey. So, whether you've been through the more traditional therapy route or not yet, you need to know your options. Now, let's talk about the alternatives you have if you want to stay together and heal after infidelity. 3 main ones I'm going to talk about: the DIY, do it yourself, the non-professional, and then the professional route. So I'll start with the DIY. Basically, this is anything and everything you can do by yourself. That means reading books about infidelity, about the healing, reading blog posts, consuming information, and sometimes taking certain e-courses that are more informational and less transformational. Now, what that is, many times in my opinion, it's a great way to go about this because you get a lot of information, but I don't think that that's going to be enough because this is such a chaotic crisis where literally probably one of the hardest thing a couple can handle in a relationship that has the potential to destroy the relationship. I don't know if only consuming or reading a book or even 10 books is really going to help you transform and heal. So this can be a nice addition, but it cannot be the only thing you do unless you are really, really going through this with no problem. You feel like you don't need any type of further guidance beyond a book. The second option is, I call it the non-professional. Probably some people will disagree with me, but what I mean here is when you take courses or programs or guidance from someone who doesn't have the proper training to deal with such serious emotional situation. And what I mean is sometimes people who've been through infidelity and believe that their experience can help others. And so they're going to want to offer guidance, right? And sometimes that can be great because you want to maybe, get some advice from someone, but I don't think that that's enough. Sometimes people who are life coaches are going to offer that guidance. And here again, life coaching is non-regulated profession. So anybody could decide that there are life coaches, and those who, want some kind of a certificate can do it in 3 days or 3 weeks or whatever. So it doesn't take much to become a life coach. There aren't a lot of requirements. Sometimes there are, but you don't know and you cannot guarantee that. And even with that, it does not make a person qualified. and really specialized in a way that couples in the aftermath need, if you know what I mean. So that's an option. And then the third option is the professional and transformational route. And this is what I would consider probably the best option. And what I mean is to get, so a few things have to be part of what I'm talking about. Number one, the person guiding you has to be a professional. They have to have the education, the training, and the experience to be able to help you. And they have to have the education, training, and experience in affair recovery or infidelity recovery. So a general experience in therapy or a general experience in helping people is not enough. It's really not enough. And maybe having, 2 years in working with children and, another year, it's not enough. You need someone that has at least 10 years of experience, specifically working with couples in the aftermath of infidelity. I think that we all understand that in order to call yourself an expert, you have to have at least 10 years of experience in what you do, in what you say you're an expert in. So that is one aspect. The working with an expert, not just somebody that calls themselves an expert, but somebody that can actually back it up with education and licenses and whatever it is. Another component of that professional route is to have some kind of a roadmap, of a pathway, of some kind of a step-by-step process that takes people from point A to point B. And in that process, there have to be some tools that these people can use in order to transform. You don't transform just from talking about your problems. That is sometimes in certain situations can be very transformational, but it cannot be the only thing. You have to give people some order in the chaos that they're in. You have to give them some, idea of this is what you're going to go through. I've been through that with other couples, and this is what they've gone through, and you will go through something similar. You have to be able to be, such an expert to, of course, customize it to people's needs, right? Not every couple after infidelity is going to experience the same thing, but you have to get as a couple some kind of an idea that this person's going to help you, has a roadmap. They know what they're doing. And you have to know that you're getting tools, because if it's only about talking about it, you're not going anywhere. You need tools. You need to practice those tools, and you need to make sure that you can use those tools after this person is gone. And maybe the last part, which very much connects with the other two, is the transformation. So really, I don't know that people just want a bunch of tools or a bunch of steps. They don't really care about, if I have 3 steps or 4 steps or this tool or that tool. This is my problem as the expert. You have to worry about, are you going to really get to where you want to get, to your goal? Whatever your goal is, the healing, the trusting again, the enjoying the relationship, the loving your partner, having a loving relationship, all of those things. And will you be able to transform and to experience that through whatever this person, this program, coach, whatever it is, offering you? And I think this is really big. So let's talk about what you can do to find the solution that's going to be best for you. You can learn from the following tips what to do for when you want to save your relationship after infidelity and not end up in ongoing weekly scheduled arguments in a therapist's office. So these are the tips. Number 1, when you look for somebody to work with, look for a roadmap or a spelled out plan to get you to your goal. If this person is avoiding and telling you there isn't really a roadmap, or we're going to talk about what is bothering you, we're going to give you an open, this word safe space scares me, because safe space feels like an empty space that you're going to have to fill with words, and the therapist does not take any responsibility. So look for someone that says, I know how to get there. I have a plan for you. I will get you there in this way and this way and then that way. Okay, tip number 2. Look for expertise and experience. So like I mentioned before, research who you're working with. It's really unbelievable that sometimes couples will work with those who literally say that they're not experts in infidelity, but they were available. They had the availability. Again, this is not a little thing that bothers you here and there that you can, maybe waste a couple of months to see if it's working. This is a crisis. This has the potential to destroy your relationship. It has the potential to damage you as a human being, your mental health. Look for an expert. Ask them questions. Do not be afraid to ask. I love it when people tell me, so tell me more about yourself, like how, you call yourself an infidelity expert. How many years have you been doing this? I love that. And so ask about their experience, ask about their trainings. Don't be afraid to ask. Number 3, ask about bias. I can't tell you how appreciative I am when a couple asks me. They usually will prepare for that. They're going to say something like, listen, I know it's an uncomfortable question, but we've had our experience with therapists before, and we just want to make sure. What is your opinion about infidelity and about the healing? And, is there a bias that you have or something along those lines? And I am so thrilled because I feel that, yes, you should know. You should know if I am biased. You should know if I believe this or that, because you might not want to work with me if I don't align with what you need. And it's perfectly okay if a person tells you, something that you don't like to hear, and you say, I'm not okay with that. The answer that I give as far as, my opinion is that I don't feel that it's my role to be a judge. You, the couple, are not in court. You're not in the principal office, and I am not the judge or your principal. And I've worked with so many wonderful people who also happen to engage in infidelity. So I don't have a preconceived opinion of anybody. I've worked with amazing people who have been hurt by infidelity and decided to stay and rebuild the relationship. I don't have any opinion about it. And I actually called my program It's Okay to Stay, mostly because of the huge shaming going around, against people who actually decide to stay after their partner cheated on them. And so this is what I explain to people. If you hear something different, then probably there might be some kind of a bias that you want to look out. Number 4, refrain from individual solutions for a relational issue. Okay, let me take a breath here because this one happens so often. So I'm going to repeat number 4. Refrain from individual solutions for a relational issue. Couples who reach out for help in the aftermath of infidelity are often pushed into individual solutions. So much so that they think that that is the only way to go. So they're going to go, so the hurt partner is going to go to do some individual counseling because they can't seem to stop with the intrusive thoughts. And so they think, okay, let me go fix myself and then I'll come back to the relationship and everything will be fine. That will not happen. That will not happen because the person who has the power to heal the hurt partner's heart is not in the session. And the solutions that are given to that individual are individual solutions. And infidelity, everyone, is a relational issue. And therefore, don't look for individual solutions. Look for relational solutions. Look for someone who says, I need to see both of you. The roadmap that I have is built for both of you. We need you to turn towards each other and start collaborating and do some healing together. If you hear that, you know that's the right direction. Okay, number 5, look for tools and guidance in implementing them. And basically what I'm saying here is sometimes you are going to get into couples therapy where 100% of what's going to be done there is talk. I'm talking about what you're experiencing, and I've talked about it before. You know what I'm talking about, the venting, right? Now, if there are no tools, actual tools that you're going to be able to learn and use, and not just learn here, read this book, because I've heard that done so many times where people, therapists will recommend, oh, there's this wonderful book about infidelity. Why don't you read it? No. I mean, it's great to read books as enrichment, but it cannot be something we hope a person is going to read. And because sometimes people don't like to read, number one, sometimes they read and they don't necessarily learn from this. And so am I as the client, are we as the couple, are we going to get tools? And if we are, what are these tools? What are they going to help us do? And then if we get tools, then do we get to practice them with you, or are we kind of sent home to do that? All of those things have to happen in order for you to be able to move on and improve, not just move on, improve. Okay, number 6, we're almost done. Number 6, look for content. So usually when people, look for a therapist or someone to work with, they're going to go online and start looking for things. And most of the people, 95% of all the people that work with me come to the meetings already knowing me from something that I've done online, some of the content that I provided them for free, right? Like this podcast. Most people will listen to the podcast. They're going to listen to more episodes, and then they're going to feel like she makes sense to me. Let me see if I can meet with her, or I don't like what she has to say and I'm going to pass, right? So when you are about to work with someone, look for their content. Look at their website. Are there any blogs that this person wrote? Do they have a podcast? Is there something like maybe YouTube videos, something that I can look into to learn about this person before? And in that content, look for ideas that go beyond the simplistic advice, that go beyond the go for more date nights or schedule sex. Everybody can say that. You don't have to be a couples therapist or a therapist or anybody to say that. Anybody can give that type of simplistic advice. Look for somebody that actually has a point that you never thought about, or that, makes you feel heard and understood, that, something like that. Many times when people listen to the podcast, what they tell me, and then we meet, what they'll tell me is, I felt like you're sitting in my brain and you know what I'm going through. It's unbelievable. How do you do that? And so I think that, and I hear that from hurt partners and from unfaithful partners. And so look for that type of content that this person is able to provide that makes you feel a little different, that makes you feel like this person can contribute something to you beyond the simplistic advice. And our last tip, number 7, look for solutions that have worked for others in a timely manner. And I put in parentheses in my notes, not vague, right? So again, do not look, if anybody gives you some vague idea of what, we're going to talk about it, no. Look for solutions that have worked for other people. For example, in our program, we tell people, hundreds of couples have gone through this program. Over 90% have said that they feel that they've reached their goals or were very close to reaching their goals. 100% of all of our clients have said that they would recommend this program to others. Here are the reviews. So we literally have reviews that people wrote, and they actually said, yes, that's perfectly okay for you to use that if, a couple wants to learn more about your program. Go ahead and read those. So look for something that has worked for others, not something that somebody, just started doing and over years. And look for so inside that program, is that research-based? Because if it is, it worked for others. Is it leaning on something that other people tried and it was researched in a acceptable way, right? So you don't want just the research of that person to tell you, oh yeah, it works. Make sure that, this program is offering research-based tools, and ask what they are. We specifically work with the Gottman Institute. We were all trained with them at the highest level, and we use their tools. We've been using them for over 10 years, and they really, really work well. And so we're not going to change that ever. So look for that, and make sure that whenever you are about to start something, don't just start it because somebody has a title of couples therapy in their website. Because, again, this is not a little thing that your relationship is going through. This is a major crisis. And please, I am literally begging you not to address it or under-address it as a minor little thing that anyone can help you with. No, you need an expert to help you with this. And you need really good guidance through this. And trust me, it really doesn't have to take long. So if anybody's telling you you're going to be months and months in therapy, they are not giving you the whole truth. Or maybe they do believe that, because that's what they've been doing. They have been really helpful. And so it takes people months or years to heal. It really doesn't. It doesn't have to take more than 8, 10 weeks, 90 days. You can learn everything you need to learn and heal, and then continue on your own on your healing path. So it really doesn't have to take that long. Okay. Now, I consider this episode as a service to all of you who are in the aftermath of infidelity, who are trying to navigate the world of couples therapy. You're trying to understand who can help you, in what capacity. I know how confusing that can be. It's also dedicated to those of you who are currently or have been to session after session feeling like you're not getting anywhere. Like you're not really getting the tools to handle the pain and heal. And lastly, it is with great appreciation to the couples who speak to me on a daily basis and share their experiences of how they tried fixing things and what was helpful and what was not. I really thank these couples because without them, we wouldn't have that type of information. I would only know about my type of therapy, and you would only know about whatever you've experienced or haven't experienced yet. And so I hope that this resonates and it helps you go through this more equipped to make a wise decision that has the potential to save or break your relationship. Okay, so time to say goodbye. Please don't forget to subscribe to this podcast so you can get alerts when we have a new episode out. And I love it if you can rate the show on iTunes or Spotify or anywhere you listen to your podcasts so we can get as many couples as possible listening to this podcast. Have an amazing rest of your day or evening. I can't wait for our next episode. Thank you for listening, and bye for now.